Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching off-ski and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your off-ski exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam.
Hello. In this video, we're going to go through some questions for your CBT exam Part B. A registered nurse has to follow a duty of candour. This is demonstrated by being. Answers are careful to avoid reporting mistakes to protect the team's reputation, open and honest when things go wrong, including offering an apology, quiet and discreet when raising a patient's concern, loyal to colleagues by avoiding discussions about errors with patients. Okay, so the answer to this question is open and honest. So when we talk about duty of candor, this is being open and honest, and this is the kind of thing, when you make a drug error, that kind of thing, you need to admit to it instead of hiding it, is what they're talking about in duty of candor. Which of the following is an established assessment tool used to assess pressure ulcer risk? So this is the Waterloo score, and this is one we use it here in the UK. It's like a risk assessment, which you basically score the patient of how far they're at risk, how much they're at risk. News 2 is your vital signs chart we use in the UK. I don't know if you've heard of that. If you have not, please look it up because that will definitely be in your exam. And AVPU is for measuring the altered states of consciousness. So it's like starting from alert, and then you've got voice, responding to voice, like, when we shout at the patient to wake them up a bit, and then obviously responding to pain and unresponsive. Okay. So next question, what does scale 2 refer to on the News 2 scoring system? A scoring method used only in emergency departments, a separate parameter used for patients who are carbon dioxide retainers, the escalation protocol for patients with sepsis, a scoring system for pain management in respiratory patients. So this is talking about our like COPD kind of patients. So it is the carbon dioxide retainers. So please, if you're not familiar with the news chart, look it up because there'll be lots of questions about this in your CBT exam, and you will have to complete it in the off-ski. It's basically just an OBS chart, and on there you've got colours, and they sort of point out to you how unwell the patient is. So for this scale 2, it is for our carbon dioxide retainers. So as we know, their saturations are going to be lower than normal, their target saturations. So it's to keep them within that range that's normal for them. What does unconscious bias refer to in nursing? Deliberate discrimination against patients based on their protective characteristics, automatic, unintentional attitudes or stereotypes that affect decisions and behavior, strict adherence to hospital policies without exception, ignoring patients' needs due to workload pressures. Okay, so this is the automatic, unintentional attitudes or stereotypes that affect decisions or behavior. So this could be when we talk about unconscious bias, it's about things maybe you were brought up with, maybe you were brought up like in a household that was a little bit racist and that kind of thing. So maybe unintentionally you've sort of taken on some of those behaviors. That's just an example, the easiest example I can think of to explain this. Okay. Which of the following professions are specifically trained in smoking cessation? Dietitian, chiropractor, hypnotherapist, or pharmacist. So pharmacist. So when we talk about smoking cessation, obviously we're talking about quitting smoking, that kind of thing. And best advice place the patients can get advice from is from the pharmacist. They will be able to give like the gums, the patches, all those kind of stuff. Okay, and thank you for watching our video today, and good luck with your exam.